The prevalence of childhood obesity is increasing at an alarming rate. Globally, in 2016, the number of overweight children under the age of 5 is estimated to be over 41 million. Almost half of all overweight children under the age of 5 lived in Asia and 1/4 lived in Africa. Although the definition of obesity and overweight has changed over time, it can be defined as an excess of body fat, as Dr. Twalib Olega explains. Dr. Twalib is a consultant pediatric cardiologist at the Uganda Heart Institute.
In simple terms, you are too heavy, your weight is too heavy for your heart.
Dr. Olega says overweight and obese children are likely to stay obese into adulthood and more likely to develop non-communicable diseases at a younger age.
We know that if you're obese as an adolescent, then you're 80 times more likely to be obese as an adult. 1 out of every 10 children is obese in our city. If you go to the rural areas, the numbers are much less because they have a lot more free time, a lot more space to play, and probably not much food.
Obesity can be measured by calculating your body mass index.
We get your weight in kilograms divided by the square of your height in meters, and then we calculate.
According to Dr. Olega, the standards used to calculate BMI are as follows. A normal body mass index ranges between 18.6 to 24.9. Between 25 and 29.9, you are considered overweight. And if your figures are above 30, you are considered obese.
So every time your BMI increases above 25, your risks for complications related to overweight or obesity increase.
Health experts say lack of physical activity is one of the biggest risk factors for obesity in children. They also warn parents to prohibit their children from spending longer hours while on television.
And sometimes also children, they spend most of their time in school and are given too much homework. So if you have homework in 4 subjects, you're a primary school kid, you are dropped at 6 a.m. in the morning because your parents have to go to work. Then maybe you come in late in the evening and then you have maybe a 1 or 2 hour homework assignment. What time are you going to exercise?
The World Health Organization warns that if current trends continue, the number of overweight or obese infants and young children globally will increase to 70 million by 2025.
Before you know it, your child is not performing well in school, your child doesn't like school, your child isolates herself or himself from other peers because they look down on them, they call them names.
Obesity in childhood is associated with a wide range of serious health complications and an increased risk of premature onset of illnesses, including diabetes, insulin resistance, heart disease, and some cancers like endometrial, breast and colon cancer.
75% of our children who come to the Heart Institute, they have congenital heart disease. That means they are born with it. The other 25% come with acquired heart diseases. Of those, rheumatic heart disease is the commonest, followed by children who have high blood pressure from chronic kidney disease. And then there are children who are referred with suspected high blood pressure. Those one will take about 5%. Who come with suspected high blood pressure or they have symptoms which are indirectly attributable to their overweight, to being overweight. We know in our country we have studies that show that if you're obese, then you're more likely to be hypertensive as a child.
Overweight and obesity, as well as their related diseases, are largely preventable. Prevention of childhood obesity, therefore, needs high priority.
Playtime at school should be protected. Days should be dedicated to activity in schools, and then eating healthy. And parents can really enforce that they can enforce the good eating habits, and then less time for TV.
The World Health Organization also recommends that exclusive breastfeeding from birth to 6 months of age is an important way to prevent infants from becoming overweight or obese.
If we diagnose you as an adolescent with primary hypertension, that means there's no secondary cause. There's no cause which is reversible. I told you the reversible causes are either kidney disease, the most common, or it is some heart disease we call coarctation of the aorta. That one we can correct it here. So if it's not that, and we think that this hypertension is primary, it's familial, it's because you're overweight, then we give you lifestyle modification advice to try to change your lifestyle before we put you on medication.
Walter Mwesije, NTV.